What are some of the social determinants which hamper the effective, collaboration between these two donors, NGO, and governments across the African continent?
Unfortunately, I would say one of the main social determinants is a kind of ideology, and it's an ideology that mostly is promoted by my own country, the United States, which is that the private sector will deliver, and this idea that, any interference, government regulation will interfere with the market's efficiency. But we know that in every country that has a long life expectancy, 70s, 80s, human life expectancy, there is a significant provision of care for everyone. And so why would we expect that African countries would have even more privatized systems than the United States or England or France? And so I think this kind of very severe implementation of the neoliberal market theory has really hurt Africa on education, on health, on infrastructure. So I think that the social determinants here are ideology and the lack of ability of African governments, especially in the 70s, 80s, 90s with neoliberal and structural adjustment programs to develop an adequate safety net for the population.
In what ways, do aiding healthcare help alleviate some of these concerns that you've addressed?
Yeah. So, having the privilege to have worked in Rwanda, which is a country that has really worked very hard to coordinate aid, to insist that donors and partners fit in with the national plan, is willing to reject aid that does not fit into the national plan, and really kind of impose a certain level of sovereignty over the money coming into the country and track that donor money and assure that it reaches the intended recipients. And I think so what we need to do is raise up, and happy to be here with so many wonderful African leaders, and the president of Ghana spoke so beautifully this morning about the need for this strong leadership. I think the leadership to coordinate what is done in one's own country is the way forward.